Let's go ahead and get started with our board meeting, and I'll start with introductions. I'm Pat Malone, Benton County Commissioner.
Joe Kirby, County Administrator.
Annabelle Jaramillo, Commissioner.
You're jumping the gun, Annabelle Vance, Crony, County Council.
Okay, now we'll go to the ones that are calling in. Annabelle?
Yep, Annabelle Jaramillo, Commissioner.
Dan Oshiro, Commissioner.
Sherilyn Dahl from the Health Center is on the line.
And Shane Galloway from Parks Department.
Lori Starlaw, Parks Department.
Laura Brown, Benton Soil and Water Conservation District.
Greg Durrett, Benton
Greg
County
Durrett.
Commissioner.
Go ahead.
Amy Wilson, District Attorney's Office, Victim Services.
Matt Weatherall, Juvenile Department Director.
Mary Autry, Finance.
Tammy Webb, Human Resources.
Eric Milo, for Recorder.
Did you check in, Grace?
Grace McDonald, IT.
Morning?
Morning.
And looks like we have Gary Stockoff. Hi, Gary. All right. And are there any comments from the public? I see Mike Wildstein listed. Are you there, Mike?
Yeah, hello, I'm just listening in.
Okay.
I don't plan to comment, thanks.
All right. All right. Well, are there any other members of the public that want to comment at this time? Hearing none, we'll move on to review and approve our agenda. Joe?
Commissioners, I would like to add an item onto the agenda under the section of other, and the topic would be the Criminal Justice Project Manager position that I've spoken to each of you about individually over the last week or two, and I do need direction on this particular item, so I would like to add it under other at the end of the meeting.
Okay, is that the only change?
That's the only change that I have.
Okay. So do we need to approve the agenda
As amended.
as amended?
I would move approval as amended.
Second.
It's been moved and seconded. All in favor, say aye. Aye.
Aye.
All right. Agenda is approved. Next up is chair decisions, and I don't think I've made any since our last meeting.
As it relates to the incident, coronavirus incident.
Right. Okay.
Right, remember that this particular item is to give the board a chance to approve any decisions that were made pursuant to the emergency declaration. So.
Okay. Well, I was proud I remembered that I hadn't done anything.
It'd be worse if you started making things up.
All right.
But what day is it anyway?
All right. So we're on to number 5, work session, discussing establishing a full-time regular database administrator in IT. Are you going to handle that, Grace?
I think Tammy's gonna do an introduction. Is that correct, Tammy?
I certainly can. Good morning. And I apologize. My computer is giving me a little bit of a problem. IT prepared a position request to add one position. This will be a new position. The position is for a 1.0 regular FTE, a database administrator, and IT analyst 3, which is at the salary range of a C45. The position was discussed and reviewed by Human Resources, Budget, and the Position Review Committee prior to coming before the board with the request. Grace can explain the need.
Go ahead, Grace.
Great, thank you, Tammy. So the database administration function, so this is something that IT does, but it's spread out among various staff. The primary is to ensure the county databases, the storehouse of county data, is performing well, is secure, manages moves, and just the day-to-day operations. With the way IT is currently staffed, we have enough capacity to do what's required. However, it doesn't allow us to do anything to help advance the county. And this is actually a position that I wasn't planning on asking for mid-budget cycle. I was planning on bringing it in the next budget cycle. The health department and the community health centers approached us last year to talk about a need that they have to essentially bring together all their different data sources in order to do analytics and to support data-driven decisions. The requirement to do that, it really does require a full-time position because it's an ongoing thing. It requires us to take all our databases, which are really based on transactions and are not good for getting data out, but to kind of flip the format in which they're stored and to create a data warehouse where the health department could use regular staff to do analytics, to create dashboards, and to get answers to the many questions that they have. So we've gone through a discovery with a vendor to kind of help define what that project is, and it's really a proof of concept at this point. But in order to move us forward, we would need this position. This would also put in the groundwork to support the county as a whole to make data-driven decisions. And I should explain what I mean by that a little more. So I'm sure all of you have had to ask for certain analysis to compare data from one database and one from another. Typically that takes a lot of manual effort. You have to create spreadsheets, you have to compare them. And this could take days, to weeks, depending on how complex this is. What a data warehouse does is we ask the questions, what do you need to make decisions? What answers aren't you getting from your current data? And we format the data in a way that you can get near real-time analytics on how certain programs are performing, what changes you might want to make. I'm not sure I explained that super well, but does anybody have any questions about that?
Yeah, when you're talking about comparing different sources of data, I'm not sure I understand what you mean by that.
Okay, let me dig in a little bit. So let me use an example. So in our financial system, if you want to get an export of data out of that, you have to have either someone from IT or someone with intimate knowledge of the system to pull that data out and put it in a format that you can make a decision on. The data warehouse kind of takes that very difficult structure of data and it flips it in a way that is understandable to a layperson, so that you can dig in to get details, you can look at trends. Now it takes the additional step is, let's say you wanted to compare data from our financial system and our performance management system, NeoGov. Now if you want to compare data from those two systems, it's a manual process. You have to have someone who understands both systems, pull data out, use a series of spreadsheets in order to format the data in a way that you can get down into the answer that you want. What a data warehouse does is it takes all these different data sources and it puts them into a single repository, so you can compare one system with another, and it comes across as a single data source. So you can look at trends across all our different data. Right now we have in the county hundreds of different systems that store data. They don't talk to each other unless by some manual process. This kind of flips that and makes it available. But it is an ongoing effort. It's nothing that where you're one and done. You have to, it will constantly evolve as questions change, as initiatives change, and as programs change. Did I explain that okay, Caitlin?
I can give another example too that's very real right now, and that is the Criminal Justice Systems Initiative. We had to use a variety of spreadsheets to pull together the data reassessments, and we'd like to have ongoing tracking of certain metrics within the criminal justice systems improvement process. And in order to do that, the data warehouse would be immensely useful in order to be able to look at data from the health department, as well as data from jail, from DA's office, and be able to integrate it and put together reports that are more than just parallel data sets. And this is essential for the quality control, QIQC work that health is doing, and I'm very grateful that they are bringing this up so that we can start to use this kind of data analysis across departments.
Commissioners, I would like Sherilyn to also interject an example. She's been a real champion for this particular position, and as Commissioner Ozro just alluded to, I think it's a critical position for the community health clinics as well as the health department. So Sherilyn, do you want to interject any thoughts?
Yeah, I think another good example is how all of our clinical data is in OCHIN, in the OCHIN system, and so we're monitoring all of our clinical metrics and social determinants of health data. All of that sits within the OCHIN system. All of our financial information sits within Munis. And so for us to be able to connect the two data sources, we will be able to do more decision making on cost of service. And I think that's one of the important things that we're really looking at. Carla has had the opportunity to brief you all a little bit on our data strategy and our value-based pay, where we really want to improve our ability to demonstrate our value through the connection of clinical quality and cost, and to have the capacity to be able to do the data aggregation through this central system would be extremely valuable for that.
Thank you, that helps.
Any other questions or comments for Grace or Tammy on this position? Hearing none, I'll entertain a motion.
So moved. I would move to approve, we want to move it to the April 21st agenda?
Commissioners, if I can interject real quick, I mean, if you are of like mind to approve it today, that would be our preference. If you do wish to move it to a future meeting date, that's certainly up to you. But I guess based on the Position Review Committee and representing Grace, we would like to get this hired sooner rather than later.
Yep.
Okay, then I would change that, retract it, and I move to approve the establishment of the 1.0 position in IT.
Second.
All in favor of the motion, say aye.
Aye.
Motion carries. Thanks, Grace and Tammy, and look forward to getting that position filled.
Great, thank you very much.
Thank you. Thank you very much.
Next up, discussion of intent for the Bell Fountain Play Structure Replacement Grant application. Is that you? Are you up, Shane?
Yeah, I'm here. This notice of intent for grant is through Oregon State Parks Local Government Grant Program. And this is strictly to supplement, hopefully, the capital improvement funds that have already been approved for the playground replacement. If we're successful, we will use it for expanding the amount of play equipment that we would otherwise have.
Okay.
And that's about it. I can't think of anything else there.
And that's a 50% match from the state parks, is that correct?
Well, we're submitting it as a $40,000 ask, and we currently have 75 committed to the project.
Okay.
So this would just be a bonus.
Okay.
Sounds like a good idea.
Any questions for Shane on the grant?
No,
I can't access my packet. Are we forwarding this to the April 21st meeting?
I was looking that up myself.
Just approve it.
Well, I will point out while you guys are looking, I will point out that we are now in a mode where we are combining all of the work sessions and regular meetings.
Yeah.
So, the typical protocol for.
move it to first, right?
What now, Annabelle?
I think, did you say move it to the board meeting?
Well, this kind of is your board meeting, so if you guys are if you're inclined to approve.
That's what I was trying to get straight in my mind.
Yeah, so if you're,
What you were saying.
if you're
That's what I
inclined
thought.
to approve something at these joint meetings, there really doesn't seem to make any sense to push it forward for 2 weeks. You know, the old method of doing it when we were all in the same room was designed to give you guys an opportunity to consider a proposal, ask for questions of staff, and then really as a background opportunity, and then push it forward to your board meeting for consideration. Because you're combining your work sessions with your regular meetings, I would suggest that these more straightforward presentations could very easily be approved at the time you consider them. Clearly something with more background and that requires a lot more input or questions of staff, you might want to consider pushing forward, but these routine items, there's no reason to delay them.
And Commissioners, this is Joe, just to add on to what Vance is saying, anything we can do right now to streamline our work is essential because our staff is so overcommitted with trying to address the coronavirus incident. And so anything that we can do to expedite things right now that you're comfortable with, I would ask that you do that.
Okay.
That way it reduces additional workload to move it forward to the next meeting. And so I would support Vance's comments.
Well, then I would move to approve the notice of intent for natural areas and parks to apply for a grant through the Oregon State Parks Local Government Program
will second that.
It's been moved and seconded. All in favor of the motion, say aye.
Aye.
Motion carries.
Thank you.
Thanks.
Thank you.
Thanks,
About this park, I'm looking forward to seeing it completed.
thanks, Shane.
Thank you.
Commissioner, do you need to bring anything up on this for you?
Not unless we take things out of the consent
Okay.
agenda. And I don't know what's going on here, but I can't bring
Do you want me to bring it up for you?
up. Let's go ahead to item 6, our consent calendar.
Before you anybody decides to make a motion, I got an email here from Teresa Farley who says, please add the CAFFA approval to the agenda. Materials are included in the packet, but for some reason I guess I did not include it on the agenda. Jen is listening and tried to get this included. So there's an item that is in the packet that is the CAFFA topic, and don't ask me what that stands for because I don't know.
CAFA grant application,
But it's
6.5, I
6.5,
believe.
so it is part of the consent calendar, it's just not listed on the agenda.
Okay.
This is Teresa. Jen is on the phone, so if you need to have her explain it, she can.
Okay, that's that.
So Jen, this is appointing Jim Wirtz and Jennifer Beeth to the Forest Classification Committee?
No.
No.
That's the old agenda.
So let me just interject, Commissioners. I believe the item Teresa is referring to is identified as the approval of the assessment and tax grant application for the fiscal period 2020 to 2021. Jen Ambule is on the phone to brief the Commissioners on this if you find that necessary. Otherwise, if you don't need that, you can just go ahead and just approve it in conjunction with the consent agenda that's been provided.
And we've done this, we do this every time we get ready for a budget.
And that's correct. Did
I would
you,
move approval of the consent calendar.
I'll second that.
All right. It's been moved and seconded to approve the consent calendar, items 6.1 through 6.7. No, I'm sorry, 6.6.
actually, no,
It is
there's,
6.7.
I think there is a 6.7, which are the minutes.
Okay. All in favor of the motion, say aye. Aye.
Aye.
Aye.
Motion carries. All right. Next up is the item 7, proclamations. In the matter of proclaiming in the week of April 19th to 25th, 2020, Crime Victims Week, is John Harrelson with us.
So this is Katie Wilson, Victim Services Manager
I'm
with
sorry.
the VA.
Yep.
Mr. Harrelson is ill at home, so and the conference that I was going to be at has been canceled.
Okay, I should have figured that out earlier. But, so if you would go ahead and read the proclamation.
Thank you. Americans are the victims of 20 million crimes each year, affecting individuals and communities. And in 2019, in Benton County, the District Attorney's Office Victim Program assisted 2,969 crime victims. Many victims face barriers that keep them from accessing the services and criminal justice systems that can help them recover from crime. Benton County strives to expand the circle of those prepared to respond to victims and link them to the resources they need to help them recover. Engaging a broad array of healthcare providers, community leaders, educators, and businesses can provide new links between victims and services that improve their safety, healing, and access to justice. Benton County is hereby dedicated to strengthening victims and survivors in the aftermath of crime, building resilience in our communities and our victim responders, and working for justice for all crime victims and survivors. And therefore be it hereby proclaimed the week April 19th to 25th, 2020 as Crime Victims' Rights Week, and reaffirm Benton County's commitment to creating a victim service and criminal justice response that assists all victims of crime during National Crime Victims' Rights Week and to express our appreciation for those community members, victim service providers, and criminal justice professionals who are committed to improving our response to all victims of crime so that they may continue to seek justice, ensure victims' rights, and inspire hope.
All right. I would entertain a motion to approve the proclamation.
I'll move to approve the proclamation.
Second.
All in favor of the motion, say aye.
Aye.
Motion carries.
Thank you, Kate.
Thank you.
All right, next up is the matter of proclaiming April 2020 as National County Government Month. The nation's 3,069 counties and county equivalents serve more than 329 million Americans, providing essential services to create healthy, safe, and economically resilient communities. And through the National Association of Counties, President Marianne Borgelson, presidential initiative focusing on services to our elders. NACO is demonstrating how counties deliver people-centered services to our most vulnerable residents nationwide. And as we face a global pandemic of COVID-19, counties are the front line in emergency response. All across the United States, county public officials are working hand in hand with emergency responders to prepare for, prevent, and manage COVID-19 infections. Equity and health are core values for Benton County communities, and all county employees are working to staff our COVID-19 emergency operations and to provide core county services while protecting the health of everyone. Now more than ever, Benton County and all counties take pride in our responsibility to protect and enhance the health and well-being and safety of our residents in efficient and effective ways. And as the ultimate safety net, county investments in public health and affordable, accessible, and equitable health care are critical to support the physical and psychological and economic health of our communities. Counties are forging creative strategies with public, private, and nonprofit partners to protect older Americans from COVID-19 while also minimizing the harm of social isolation. Counties are a critical partner at the table with federal, state, and municipal leaders to support economic resilience and to address health, safety, and equity across America. And the National Association of Counties theme for National County Government Month this year, Counties Matter, has never been more pertinent. And Benton County, as one of the original counties from before the establishment of the Oregon Territory, has a long distinguished history of service to its residents and continues to adapt innovative practices to serve its residents in the present and the future. Now, therefore, the Benton County Board of Commissioners hereby proclaims April 2020 as National County Government Month and encourages all residents to actively participate in their county government, adopted this 7th day of April 2020. Do we need a Motion,
I will move, go ahead, Suzanne.
No, go ahead.
I'll say, I move to approve the proclamation.
I will second that.
it's been moved and seconded. All in favor, say aye. Aye.
Aye.
Motion,
I just wanted to, excuse me. I wanted to make a quick comment about this. We had other proclamations that are also issued us for this month, and I wanted to not let this particular one slip because of the fact that all of our employees are working so hard right now on this COVID-19 response. And I felt like it was one of the things that we, as the board, definitely could do, just as a minor token of our thanks to everyone that's working so incredibly hard. So, thank you, everyone.
Likewise,
all right.
but I thought it would be appropriate as well. I just, everybody's really pitching in and doing what they can, so this is a good thing.
All right. We'll move on to number 8, Emergency Response Policy Team. We'll start with the Health Department priorities. Charlie and Danielle.
Okay. Thanks very much, Commissioner. This is Charlie. The Health Department priorities have not changed. We've updated some details in our priority document for this operational period, but overall priorities remain the same. Population-wide infection transmission prevention, coordinating and fortifying the medical system, and strengthening coordinating efforts to protect and care for high-risk populations. I'm not sure, I don't think Danielle's going to be able to be on this morning. I think the most significant thing from the Health Department perspective for this operational period is starting up a behavioral health branch to parallel the public health branch. And so actually is leading that. That is going to be very important for helping to assure care of the folks that fall under the normal care of the behavioral health programs and assure adequate staffing, assure those pieces don't fall through and further endanger those folks, but also planning for the duration and then wind down of this. It's fairly certain that the long-term community mental health issues around this are likely to be as significant as the physical health issues. This is a community traumatizing event. It'll have long-term consequences, and for those folks who already experience difficulties either on a chronic or periodic acute basis, and really for all of us, there are going to be longer-term community coping and personal coping, family coping issues. So important to get that piece stood up. The other really major work going on from us, and Brian will be able to talk a little bit more about that, is continuing work, alternative care site planning, and then really intensive work on standing up crisis housing for congregate living. And so that's a big piece. We also have a major project with Oregon State University and some other collaborators to improve testing capacity, and that won't just be locally, that'll add significantly to the statewide laboratory testing capability. But there's been some barriers around getting that online. We got some major equipment moved yesterday, so it's a huge step along the way. That's it from my side, unless you have questions.
Well, just a comment, I did hear something yesterday about the state accessing OSU vet school. I think it was for chemical supplies to help with the testing, so it's nice to break down some of those silos and get the resources that we need to the right place. A comment.
That's actually. Oh, sorry.
Well,
I was going to say that's actually another OSU collaboration. That was a project to utilize OSU facilities to build more test transport media. So there's several things going on. Ours is around actual testing itself. So
now that you mentioned that, that's what I heard was the transport media that was in short supply, and the OSU Vet School had some. People on the phone, is everybody muted? We're getting some fair amount of feedback here. Okay, well, that quieted things down. And Charlie, how's your team holding up? Is your pace sustainable?
yeah, I think for the time being, we've actually, particularly in the communicable disease team, we've adjusted some schedules. We were going pretty intensively there through February and most of March. And so late in March, we backed off the intensity a bit. We've got a bit larger team, so we actually are working some shifts now to be more sure of providing all team members with a couple of days a week off. With a smaller team, we were really having to put in 7-hour days, and we were burning people out. So I think at this point, from the check-ins I've done, people are doing relatively okay. Working remotely has its own challenges, but people are so far holding up. Thanks for checking on that.
Well, sure appreciate your efforts, and glad you've adjusted to the new reality of having weeks ahead of us that we've got to take care of business.
I have a couple of questions, if I may.
Zan?
One of them is just as a result of the fact that I have been sitting in regularly with the folks that are focused on both shelter needs and food needs. And I know that there's mounting frustration in the nonprofit community that's working with folks that are houseless because they are straining their budgets to try and make sure that people are fed and that the houseless community can observe social distancing and sanitation requirements. And I know that there are funding streams available, and it's just been a very, very, very slow process to marry the funds that are coming down from the state to the Oregon Housing and Community Services, potential FEMA funds, city and county. But I would like to, again, urge expediency, because these nonprofit groups they're dipping into their own reserves. They're doing whatever they can, but we're going to need these groups to be as healthy as they can be after this crisis, as well as during the crisis. And I think we're facing an inordinate burden on some of them. And talk about burnout. Some of those folks are getting pretty frustrated. So that's the end of the speech part of it. I do have a couple of questions, but Charlie, if you have any response, I'll pause.
No, I feel the frustration, Commissioner. This is very, but it's infuriating that things move so slowly. There's no other word for it. One of the things, and Ryan might be able to talk about this also, but we just, over the weekend only, got the guidance and parameters from the state of how even to apply for congregate shelter funding from OEM and FEMA. It's just weeks late, and we have to put together an application with a budget, and if we had those parameters even before the forms and letters and everything were available, but we had no idea until this last weekend what exactly they would need to even apply for that funding. And so it makes it, that's no excuse, and it certainly doesn't assist the jam that community providers and that the people themselves who are living on shelter working under. But when we try to put something together and then very belatedly receive the kind of direction that we need to secure funding and have to go back and sort of re-guess and start over again to reconfigure things to meet those requirements, it makes it doubly frustrating.
Commissioner
Thank
Ozero.
you for that. I know that Community Services Consortium has resources they can help, they can match with what we may receive. So I'm looking forward to hearing the results of those meetings between Community Services Consortium and the folks working on these issues through the EOC. Thank you.
Commissioner Ozero, I would like to interject real quick. This is Joe Kirby. For a reminder for the board, we talked about the county potentially providing funding assistance to local nonprofits. That was a discussion the board had last week. To that end, I met with Mary Otley last Thursday. Mary's pulling out our fiscal policy and bringing that information back to the commissioners. It's probably not going to be until a week from today, but the intent of that particular conversation is to gain policy guidance from the commissioners as to if you are wanting to provide funding, and if so, what would that look like and what are the criteria for administering any funds that the county could provide. So that's what Mary is currently working on as we speak. The other part of that equation is Mary's also looking at our revenue streams and is currently working on projections for the next 6 months as to what our revenue projections look like. She will have that done by the end of this week. And anyway, just wanted to remind the board that there's still discussions that will be forthcoming to the board. Unfortunately for our small finance department, we're also supporting the EOC with several staff members almost every day. And so that's also limiting our ability to move forward as expeditiously on other topics as the board may want us to.
Thanks, Joe.
Thank you. I think that the last comment on this topic, that there are some special funds that have appeared to help support nonprofits in keeping their doors open. Of course, it takes work to get them, but they are really looking to us to deal with the public health functions. And I think that's the big thing we can do right now is to step in and actually support those public health roles that they're playing. The other question I had was a little bit more about trends here locally, and whether or not we have a good sense for whether we're and what we're going to see moving forward. And I'm sorry, feedback. I hope it's not hard on everyone else's ears.
I think she might have shut down her speaker.
We are, I think we are all getting the feedback, Sam. So I got most of your last comment, but missed part of it.
There was really a short question embedded in there, and that is, do we have any local projections about how things are going in terms of number of cases and all of that? Or is the limiting factor in terms of really putting together good projections still testing? I think we're doing, my personal sense out here without data is that we're doing a pretty good job at social distancing, but I also know that there is, at some point, going to be a diminishing appetite for it. People are going to start going back to normal routines just because they feel like nothing's happening. So I wanted to check in on that.
And I can chime in on that. This is Brian, if Charlie wants to. So Peter Banworth is actually helping us out with a lot of that, and the modeling projections are really challenging. Peter did a really amazing job and compiled like the top 10 kind of best practices from epidemiologists and most accurate, and got us some numbers. And he put them in a PowerPoint, and we'd be happy, I'm sure Charlie's seen them, but to share those with you. And they show sort of a more or less best case scenario, not the worst of worst case scenarios, but kind of the range of what's most likely to happen. I say that with a preface because the state put out some numbers that basically said, all is well, we're fine, which the hospital's not using them, we're not using them because it's very questionable their assumptions that they have in their model. It basically is saying by May 3rd, we will only need 3 hospital beds, 2 regular and 1 ICU, and that's it. Well, we're already using 3 ICU beds and 3 ventilators right now today over at Good Sam. So their modeling numbers are extremely optimistic, and on one hand, the state's saying, yes, these are good numbers, let's use these for planning, and on the other hand, they're also saying, here's guidance on mass fatality planning and everything else. So we're getting mixed messages from the state as well. So it's really challenging utilizing the numbers the state has shared with us as their numbers, their projections. And I want to say those are out of Washington. I don't remember which university or what organization. And I can forward those on to you, but they're very overly optimistic. And it's indicating social distancing is working. We've already peaked out in our infection rates and everything's fine. And that is just, Peter talked about it very clearly, and I know Charlie saw him as well. Doesn't seem to be true. Doesn't seem to hold true with what's happening out in our community.
Right.
Okay, I think it would be great to be able to get more messaging out to the community somehow, and I know the dueling model thing is a challenge. It makes it very hard to work on some of the best practices.
Yeah, this is Charlie.
Peter's numbers are really good. Go ahead, Charlie. Sorry.
Oh, no problem. Yeah, I fully concur with Ryan. Do a couple of things. One is, we have been pretty flat in our incidents locally. It's higher than those projections say, but it is still within the manageable scope of the medical community. And so based on that, we have very high population adherence with the stay home, stay safe. But there are a couple of really powerful warning flags out there, not the least of which, as I look out the window, the sun is shining and we're coming up on 3 very beautiful days. Sunday afternoon was lovely and there were masses of people out. Didn't see a lot of gathering and clustering, but it is going to be extremely challenging, in my opinion, as the weather improves, to keep people from clustering. So, you know, there's a risk in the success we've had with having people stay self-isolated, stay out of circulation. We still then have a huge portion of our population that's not been exposed to the virus, has no resistance, and kind of, if there's still virus out there circulating, which there most certainly is, the instant that those precautions break down, the more vulnerable we are, and all we've done is really delay a steep spike instead of continuing to smooth out and soften the curve overall. And so I have real concerns, and we've been talking about this even before this nice weather spell started, about how we maintain the precautions and the effort as spring progresses and the weather inevitably continues to get nice. The other thing is, we honestly don't have a good handle on how many people are ill. You know, the testing is still minimal. There are a lot of people who have some level of symptoms who may have called their provider, who said, yep, you know, that might be it, but you're doing okay. Stay home, stay out of circulation. No indication to test you or to utilize a rare test. It's still difficult to access test when there is no therapy and there is no particular need to test those people. That actually may even be true for some of the fatalities that may have occurred from other causes, other immediate contributing causes, where they have not even been testing of some of those people. So our data is unreliable, the risk is still there, so projection just becomes very difficult, and the messaging and the durability of the precautions becomes even stronger all the time.
Charlie, this is Pat. Is there, we keep hearing about that there's all kinds of test materials coming. Is any of that coming to Oregon coming soon, or are we still not anywhere close to what we need to find out what our real situation is?
Testing capacity increases slowly. You know, all this news about 15-minute tests and 10-minute tests that have been developed, those tests are still weeks, if not months, away from FDA approval and being proven effective. It's really sort of, I think, a disservice to the public that those hit the news media instantly upon announcement of her corporation has developed them, because it certainly gives the impression that just because they were invented and developed, they've not been manufactured, they've not been approved, they've not been distributed. So, no, once those are out there and commercially available, they'll certainly be as available in Oregon as anywhere else. But we are weeks at the earliest away from having any of those available.
Well, I think it's critical to do what we can to get correct information out, and I'd like to see the top 10 practices that Peter has developed and make sure that we get those out, and the word is we're doing okay now, and but we've got to continue, or we're going to have a good chance of losing control.
Yeah, I think the key message is to congratulate people on the great work they've done to prevent further spread now and just emphasize the need to sustain that effort. It's working.
Commissioners, question for you regarding Peter Banworth's information that's been referenced by both Charlie and Brian. Is that something you would like us to forward to you via email, or do you want us to include Peter in a future board meeting to review it and explain it? I have not seen it, so I don't know the appropriateness of that, but Charlie and Brian, please speak to that, and board, please speak to whether or not you have an interest for a future meeting in terms of reviewing that information.
Zan?
I would be interested in seeing it. I'm fine either way, with either a presentation or just receiving it by email.
I see a two-step process, so let's take a look at the material, and then if there are questions, then invite Peter to a future meeting. Annabelle?
Commissioner?
Charlie?
Oh, go ahead.
That makes sense to me.
I was just going to suggest that no disrespect to all of your ability to look at technical and complex data, but context is everything, and it may be beneficial to is pretty succinct and very good at briefly explaining the characterization of the data he's produced and the differences between that and what has come from the University of Washington and is in the national news. And it may be beneficial to have him do a brief explanation.
That makes sense. I was actually thinking more about the top 10 practices, but I agree with you and Vance that we may need a guide through the modeling.
So Charlie and Brian, why don't you forward that information to me, and then I'll share it with the board, and let's put it on Thursday's policy meeting with the board. And Charlie, if you can line Peter up to participate in that, and we can dedicate 15 or 20 minutes to reviewing that on Thursday.
Sounds good.
Great, will do.
If there's no more questions for Charlie, we'll ask Brian Lee to step up, and I think he's got 3 points he wants to cover. Brian?
Yeah, so next bit here, I actually want to piggyback on what the topic Dan was discussing. I'll start there. Some positive things. The city of Corvallis did approve micro shelters. I can't recall the name of the church where they were being asked to be placed, but they are within the city limits. So they're going to get some micro shelters set up. I don't know how many yet. I haven't been involved in all the conversations. I just heard that it did pass city council. So they're doing some zoning work, temporary zoning authorizations for various areas. They also are allowing still camping on private property. And so I believe some of the churches were exploring that process, last I heard. So at least some developments there. With that, to talk about the funding piece and what Charlie was referencing, the whole non-congregate housing bit that I brought up during our last meeting, we got guidance from the state on Sunday afternoon, basically, around what that looks like and what pre-approval looks like. So to house vulnerable populations in motel rooms or dormitories, it's pretty clear we have to use general fund dollars. It has to be a very clean funding stream, so it can't be any federal or state dollars in any other pot at all. So we can't supplant or do anything like that. And we have to have a, for lack of a better word, they call it like a declaration, but it's basically a letter signed by Charlie and Bruce saying that this is important and this is why it's needed. This is the population it's going to address. this is the problem we're addressing with it, and then it breaks down the financial sort of cost. So here's how much it costs, here's how many people it's serving, and here are the support or wraparound services, as they call them, that we are going to provide that are not reimbursable. So like mental health counseling was one of them that is not reimbursable as a wraparound service. So we can't bill or hire contractors and get reimbursement or anything like that. So once we outline that, we submit that basic proposal to the state, and then they said it's usually at most a week turnaround time, usually less. They approve it, and then we are clear basically to start spending the money to get reimbursement on. So it is a process. There are hoops to jump through, and then we kind of were hoping that the community service organizations would identify the population that they want to shelter. One parameter also is that has to be contained in a timeline. So they're 30-day increments. And as far as I can tell, it basically allows it where they wouldn't get like renter's rights or tenant rights after those 30 days. And that the state has to approve additional 30 days beyond that. So if we set it for 30 days, when we get closer to the end of those 30, we can ask for basically an extension, and the state has the ability to approve or deny that. So if they deny it, then it's coming out of our pocket, and that's what it is for us. Or they can continue to approve it for lengths of 30 days at a time. So that's kind of the broad overview of that process. Again, some hoops to jump through, but it is doable. I know Danielle and Charlie were made aware of that, and they are chipping away at that as far as I understand it's EOC. This is my off week, so Chief McCarthy is the EOC director, and I did leave that with the Health Department folks, Sarah Hartstein and Danielle, as well as Chief McCarthy and the operations section to prioritize and continue to develop what that looks like financially. So once they get all those together, then Charlie and Bruce can put together the letter and sign it and move forward with that plan if that's what we choose to do. So that was the non-congregate housing piece. The next piece, which actually was brought to my attention more from Sheriff Jackson, was regarding cloth masks and PPE. We are meeting the PPE allocation committee, and just a reminder, that was 5 representatives, the county fire chief, emergency management, the hospital/clinic combined, public health, and then EMS. We are all going to meet today again to discuss PPE allocation. We're using OHA's formula and some other agreements that we all made as a collective group. However, this cloth mask issue came up because now the CDC is saying everyone should actually wear masks. So the sewing brigade who made all the masks basically are asking them for us to turn some of the ones they made back, and they're coordinating getting those out to the community. So we got to make some decisions on if we're okay with that, which right now, preliminarily, we all seem to be okay with that. And then we're still getting PPE out per the state requirements. As for our county and city employees, if they're not first responders, law enforcement, EMS, fire, all those categories, we don't actually have PPE set aside for them. Because we put it all into our big stockpiles collectively together, it's actually for healthcare workers in the greater community at large. We do have a couple leads on some vendors that have masks and different things in stock. So we are exploring those, and we definitely can buy some masks and get them to our county and city employees. So that's, Scott asked me to prioritize that on our EOC to-do list. So that is still at the top. We are still pushing that one forward. And we're still looking at the hydrogen peroxide sanitizing equipment. I just want to explore all of our options on that before we present it to the board or have more dialogue about it. But it would allow us to reuse PPE, and that's certified by the CDC and FDA to do that. So that's kind of some other things we're looking into as a possible solution. So that was most of my pieces there. I just had some general updates. And then a policy that Joe actually said we already have more or less is for the EOC, for the most part, we're implementing a buy local sort of policy first, or source local first. So like all of our lunches and things like that, we're obviously using locally owned businesses to just do what we can, keep employees employed for as long as possible locally. And then we're trying to do our shopping if we need administrative things for the EOC at the very least places like Weimar, but we're trying to do as much local shopping as possible.
Great.
If we can't find something, we'll order it or we'll get it at Home Depot, but we're still trying to do everything else locally as much as possible. So those are most of my main updates for the DOC and the policy committee as a whole. Yeah, did you guys have any questions for me at this point? Oh, the last thing, the move to the new EOC location, we're actually over here today, the facilities team with Paul Walsinger, and that crew has been amazing. Sarah and I spent all day yesterday helping them. They got lights put in, we vacuumed, we cleaned up, we got tables and everything sterilized and wiped down, and we are pretty much set to go. And we have Mario from IT getting our Wi-Fi set up here today. So we are right there. We're probably going to have folks move in starting on Thursday, and that'll be our first operational day there Thursday. So that's our main focus for today, is get everything else set up and ready to go. And we're really happy for now with the space. It's going to help a lot with social distancing and just a more collaborative layout that's going to work really well for us. So we're really pleased about that.
Well, glad we're moving quickly to get you set up there. On the fogger that you talked about last week, are you still kind of exploring what's out there and what's available, and then
yes, and yes, we're still exploring basically what's out there and what's available. There's basically two versions. One is a bigger, nicer unit, but it comes with a heftier price tag, and the other ones are a little bit smaller, much smaller, but they're under half the cost, and the liquid you can buy at Home Depot, the chemical to put in it, which is just hydrogen peroxide. So we're exploring the different ideas and making sure we have a clear understanding of how it would be used, how it would help us now, how it would help us in the future. Really trying to think this one through, because it would be in my world, a bigger ticket item. The cheaper units are $20,000. The more expensive unit is like $40,000. So I'm really looking at this closely to make sure we're being responsible. But at the same time, it could help us in a lot of ways. I just want to make sure we do our due diligence and read reviews, and we're calling places that actually use them regularly to check in to see if they've had problems with them or
Great.
issues that have come up. Just trying to do our due diligence before we make a decision on something.
And once we make a decision, it may be a couple months before we actually see the unit.
It depends. One of the cheaper, smaller unit is actually, I think, a 3 to 4 week lead time. And the more expensive unit is a 7 to 8 week.
Okay.
So that was one of the differences as well. Is the cheaper unit is available sooner, which was also an appeal. So we're going to explore that to confirm and actually talk to vendors and ensure you have it more or less in stock, and we're actually going to get it in. If we order the cheaper unit, that's what we decide to go with. We actually will get it in 3 to 4 weeks and not have it get pushed out. So we're trying to finalize things like that before we make any decisions.
Great. I guess one other question I had for you, you mentioned cloth masks, and I just happened to have one here that I wore this morning, and will try to get used to wearing it. Are the instructions when and where to wear them fairly consistent? It seemed like things really got serious at the end of last week and over the weekend, as far as
Yes.
that this was a good general practice.
Yes, and basically the bottom line, and CDC and OHA are also producing good infographics and things that we'll share and put out. But they are saying wear cloth masks whenever you're out in public. I think mainly it's more for the people who may be asymptomatic, who could be shedding the virus and not realizing it, but also just it can help reduce possible exposures. But from what I understand, it's mainly if you are sick and you don't even realize it, it'll reduce the amount of virus that you spread to others while you're out and about. So it's pretty consistent now. It's pretty much, they're encouraging everyone at any time, if you can't social distance, to wear a mask. So anytime you're going to the grocery store, going to be around other people or interacting with people, to wear some sort of mask of some kind, even a bandana, some sort of covering.
Okay. Well, again, I think we need to emphasize a consistent message, and I'm glad that seemed like from the federal level on down, it is getting to be a consistent message that we need to emphasize.
Agreed.
Any other questions for Brian or Charlie?
Commissioner Malone, I would like Lilia to make any comments
Okay.
regarding the PIO function. In case there's anything.
One quick question.
Go ahead, Zan.
I know that there's one little comment tucked into the operations period plan about the regional coordination of hospital resources, and I know that that was something that caught folks a little bit off guard here locally after all the local planning. Is that relationship with the regional planning going a little bit better now?
Commissioner, are you referring to the Lynn, Benton, Lincoln, or are you talking about the medical resource hospital concept? There's a lot of basically,
The second one, the
Yes.
statewide regional communications.
Yeah, so basically what Samaritan, we're definitely going to work with Salem Health. There was a little more clarity given out by the state. They've lately been pushing a lot of stuff out, giving good guidance on what it is or instructions. That may come as no surprise, but they did clean it up a little bit, and they're saying it's only for surge planning. What we all agreed upon in our 3 counties here in a row, Lynn, Benton, and Lincoln, was that we would coordinate, do Good Sam, do emergency management, do the health department as much as possible, and then, yes, we will also coordinate with Salem Health as much as reasonably as possible. So it got a little better, but we kind of all agreed a little, kind of that balance of, we're not going to shut them out and tell them no, but we are going to say we're going to take care of our kind of home rule stuff. We're taking care of our region, our southern region first, and then we can also help accommodate, if we do have room to accommodate other patients, by all means. But we don't want to just fill up all of our beds with other region patients and then not have any for our own residents. So it's getting much better.
Thank you, that's what I was hoping, thanks.
And that was the 6-county regional hospital plan that was announced last week. Is it?
Yes, that's the one.
Okay. I think we'll have Lilia step in here and give her perspective on how the information is getting out.
I think it's getting out very well. We did a video with Commissioner Malone last week, and I received positive feedback about that. We're actually pulling together our analytics for March now, and I was hoping to have that ready for Thursday.
Okay. Anything else?
Lilia, can you speak to the work that Patrick Rollins is currently undertaking regarding information relative to addressing the most vulnerable in our community?
So So one of many pieces of talking points that we are developing are efforts from the EOC in support of those experiencing homelessness or housing instability. And so Patrick Rollins is developing that messaging and plans on having that completed today.
Thank you.
Great. Zan?
It was just unable to hear what Lillian was saying. Trying to catch all of that.
Commissioner, can you hear me now?
That's better.
So I was stating that last week, one of our daily video updates was with Commissioner Malone, and I have received anecdotal feedback from the community that it was great to see one of our elected leaders on video. Today, we are doing a video with Mayor Traver, and next week, I believe we are going to highlight Superintendent Noss. So we are trying to get some of the more visible community or more high-profile community leaders into our daily video updates. And I think that the second thing that I spoke to was Joe asked me to provide an update about one deliverable that's on our plate, and that deliverable is a set of talking points around what efforts the Emergency Operations Center has planned or implemented to support those experiencing homelessness or housing instability.
And on the video, you got at least a 1 thumbs up from Zan. Thanks, Lilia. Anything else for the emergency response team? If not, we'll move on to item 9, other, and I think that was going to be Joe.
Great, thank you. Commissioners, again, good morning. I did add this item on at the beginning of the agenda, and the topic is the criminal justice project manager position. A little bit of context for folks that may not be as familiar with this. We hired Greater Oregon Behavioral Health a number of years ago to help us with project management regarding our criminal justice assessment at the time. They did complete phase 1 under a contract. Then we engaged them in phase 2, which is the pre-design phase, and we have I believe it's a 2-year contract currently with Gobi to provide those project management services. Several weeks ago, we were notified by Ari Basil Wagner, who works for Gobi and has been providing the primary project management on this project, that she was taking on a new role with Gobi, which meant that she could no longer work on our project as the project manager. Through a number of discussions with both HR and others, I have been communicating with the commissioners individually about the possibility of approving a new county employee position, which would be a project manager position that would be dedicated to this particular project. We did about a year ago, before Gobi started project management of phase 2, we created a job description and we had it classified about a year ago, anticipating that we would be hiring a regular full-time county employee to do this. And at that time, Gobi was agreeable to just continuing the project management for phase 2. So we parked this particular position and did not pursue it, but we did continue to contract out with Gobi. So right now, for this biennium, we have $250,000 budgeted to fund that project management. To date, we've spent approximately $80,000 of that $250,000. And what I am proposing to the board is if this is in fact one of your highest priorities relative to a county initiative, that we do need to properly staff it, and we are unable to move this project forward without either hiring a county employee and/or contracting out with somebody else in the community or elsewhere for this particular function. What I'm proposing is that the commissioners consider hiring a full-time position that would be a county employee to fill this project manager position. If you are in support of this, we could immediately expedite the advertising and recruiting. If you are not in support of this, then we need to go back and revisit what other options there are. We are at a critical stage in the project where we have inertia, we have DLR on board, and yet we still need to have a project manager to help us bring this phase 2 to completion. What you would be actually approving, if you were supportive of it, is us going ahead and hiring a full-time FTE. We do have appropriate funding to cover the expenses for that FTE between now and the end of the biennium. What we would do to continue this position subsequent into the next biennium is it would be proposed as part of the future budget process. But what I'm looking for is to answer any questions, and I would really like to get direction on this. This is not our normal process. Normally, we would take the time to run this through our position review committee. About a week ago, I did give them a heads up that we were contemplating different options about how to move forward with this. However, based on individual communications with commissioners, I felt I really needed to finalize what direction we're going to go, and that's what I'm putting in front of you today. I highly recommend that we bring this project internal and that we do support it with a full-time FTE in order for us to continue to move this project forward.
Joe, part of the... Go ahead.
Joe, this person then would be in the commissioner's office?
I'm sorry, Commissioner, excuse me, I was taking a drink of coffee. Yes, this person would be within the Board of Commissioners office and would report directly to me at this point.
Okay. Thank you.
Zan?
Well, given my involvement with this project, I am fully in support of bringing someone on board to work on project management and to expedite this project and do all we can to make sure that we get advances. So I wholeheartedly approve of this proposal.
Commissioners, the dollar amount annually is estimated to be between $105,000 and $120,000. That consists of both salary and benefits, and that's just a range to give you an idea of what we would be looking at spending annually. HR could begin recruiting for this position within the next 24 to 48 hours. So I would like direction from you today.
I support the proposal and really support the quick turnaround due to R.E. Basil Wagner's imminent leaving. It would be ideal to have at least some overlap between the new person and R.E. And the only way that's going to happen is to get going as quickly as we can. Any other questions or comments?
So Commissioner Malone, I would like the commissioners to take official action in terms of making a motion so that I have that degree of certainty that I feel I need. Also, just once again highlighting that this is outside the standard protocol that we've created with the Position Review Committee. However, I do believe, based on input from the board individually, that there is interest in expediting this decision. Hence, the way I'm handling it today.
Okay.
I would make the motion that we go ahead and hire for a project manager for the criminal justice project.
I'll second that.
All in favor of Annabelle's motion, say aye. Motion
And
carries.
it's not my motion, it's already on the floor.
All right,
Thank you.
motion passes. Anything else for the good of the order?
I do have a quick question. Joe, we also talked about internal hire versus external. At this point, is this going to be a general external announcement, or and internal employees are also welcome to apply, or how are we handling that?
I will finalize that with Human Resources later today. We have considered making it an internal posting. However, considering the competition that might be out there due to layoffs in the community, we have considered posting it both internally and externally. However, we would have a short turnaround time frame on this, which would be probably a matter of 5 to 7 days before we would begin the first review of applications. So we do intend to move quickly, and right now I support providing the opportunity both internally and externally to ensure that we have the ability to find a similar skill set to what Ari came with. And I think, Commissioners, even though Ari's not here today, it's important to recognize what she brought to this project, and she had such a unique skill set that just perfectly fit the needs of our project. And trying to find somebody that has that similar skill set, I think, is going to be very difficult. However, I do think that there's folks both internally and externally that would certainly be able to take this project on.
Thank you. I think I agree with that decision. And yes, we can't replace Ari. Fortunately, she said she'd be available for potentially small contract roles moving forward. But yes, it's going to be big shoes.
All right, if there's nothing else, I will, meeting adjourned, and I will put my mask on.
Very good. Thank you.